Welcome to YARKUD International. Let's prepare for OMAN PEARSON VUE nursing examination. So today's topic is total parental nutrition. There are many questions from total parental nutrition. So today we are going to see the what is total parental nutrition, and we are going to see all type of questions so that any TPN question come, you can easily answer it. Okay. So let's see what is TPN. It will be the method of providing nutrition directly into the bloodstream. Okay, so you have to remember first point, you administer TPN only central line. Okay, so mostly only central line because there is a chance to, it is directly bloodstream and pattern line should be there, and there is high chance of infection also. So we will be choosing the central line to connect this TPN. Okay, so central line means it is peripherally inserted central line like PIC line. Okay, called PIC line, Hickman's line, jugular line, subclavian line. Okay, we will use these sites. Okay, so if the patient is unable to take food orally only, they will be support with the TPN. So there is a combination of nutrients together. We will give carbohydrate, protein, fats, vitamins, and minerals together. It is called the total parental nutrition. So overall, what is the main purpose? It will be maintain or restore the body nutrition. Okay. So remember this point. So let's see the question answer one by one. Then I will give you the key points, note down, so that any type of TPN question, you can easily remember these key points. Okay, first question. The nurse is planning care for several children who were admitted during the shift. Daily weight should be plan of care for the child who is receiving. Okay. So option A, total parental nutrition. Option B, supplemental oxygen. Option C, intravenous anti-infective. Option D is chest physiotherapy. Okay. You have to remember for the total parental nutrition, there will be the chance of getting over fluid. Okay. So if it is over fluid, okay, hyperolemia, how you will find out? By doing the weight checking daily. Okay, if the weight is increasing, it will be mean total parental nutrition will be increasing. Okay, there is a need for total parental nutrition. Maybe will be differ. Okay, we are giving overload of the fluid. It will cause hyperolemia. Got the point? So, what will be the weight checking for daily weight checking for the plan of child who is receiving total parental nutrition? Okay, got the point. So answer is A. Every child has to check the weight. Okay, remember in all the nursing competitive exams, you have to be, remember all the four options is correct only, but you have to select the best one. So here the best one, it is A. To find out the hyperolemia, we will just check the total parental nutrition patient weight checking. Got the point? Okay, let's see the next question. A nurse is preparing to hang the initial bag of the parental nutrition solution via the central line of the malnourished client. The nurse ensures the availability of which medical equipment before hanging the solution. So which equipment is needed for to hanging the solution? They are asking that. Okay. So before administer, what you have to remember, the total parental nutrition contain high glucose. Okay, so without the infusion pump, if you just mandatory, you just on the TPN, what is happen here? It will be go very fast and it can be cause hyperglycemia. Okay, so note down that point. It will be, if it is not correct amount is giving, it will be cause the hyperglycemia. Okay, so must infusion pump only, you have to give the total parental nutrition. You have to connect with the infusion pump. So what is needed here? So preparing an initial bag only, you are just going to connect. Okay, so no need to glucometer because after connecting the bag, after 2 hours only, you will check the glucometer sugars. Okay, to know whether the patient is hypo or hyperglycemic. Okay, so here the answer is D, infusion pump. Got the point? So TPN only must go with the infusion pump with the central line. Got the point? Okay. Let's see the next question. So these are the important question overall from your examination. So concentrate. A nurse is conducting a follow-up home visit to the client who has been discharged with the parental nutrition. So it is like a community-based question, okay? Because it is the home visit. Which of the following should be the nurse most closely monitored in this kind of therapy? Okay, so remember here, always read the question carefully. It is the community based and they are doing after discharge. Okay, that means you have to be here now checking for any complication. Okay, got the point? So because it is follow-up, patient not on TPN, okay, not on parental nutrition. It will be finished already. Now come back to home. Now you're checking for any complication come on. Okay, so fix that in your mind and see the options. Okay, so here blood pressure and temperature, or blood pressure and pulse rate, height and weight, or temperature and weight. Okay, what you have to be remember this. Okay, parental nutrition, there is main two complication. First one is infection. Second one, there is a complication, hyperolemia also. Okay, so these are the two important complications we have to look for. So if it is temperature, okay, if it is increased, there is a signs of infection. So when you go to the patient to check the complication, you have to check the temperature. Got the point? Okay, that is one of the thing. And here the second one, patient just got discharged. Okay, there is still the chance of fluid retention, hyperolemia. So to find out the hyperolemia, how you will find out? By checking the weight of the patient. If it is weight is increasing within 1 week, like 5 IP, they will be giving just like that only. Okay, so 5 pound like that, it means in kilogram it is 2.2 kilogram. So within 1 week they are increasing like that, there is a chance of hyperolemia. Okay, got the point? So these are the small key points you have to remember. So what you will check here? It is the option D, temperature to find out infection, weight to find out hyperolemia. Got the point? Okay, let's see the next question. A client is receiving nutrition via the parental nutrition. Okay, parental nutrition, it is TPN, total parental nutrition. Here now assess the client for complication of the therapy and assess the client for which of the following signs of hyperglycemia. Here they given already the complication hyperglycemia. So what is the sign of hyperglycemia? They are asking. So read carefully. The option A is high grade fever, chills, and decreased urination. What is the indication this? This is indication of infection, not the hyperglycemia. Okay, so leave that. Second, fatigue, increased sweating, and heat intolerant. Okay, so it is not the hyperglycemia sign. C is cold, rise, hair, weakness, and fatigue. Okay, the last D is thirst, blurred vision, and diuresis. Okay, you have to know the hyperglycemia signs and symptoms. So what is the hyperglycemia signs and symptom? I will tell you. Remember, excessive thirst, fatigue, restlessness, blurred vision, confusion, weakness, and the Kussmaul respiration. Okay, so these are the, then the diuresis. There is a urination will be, and so much urine will be come out. Okay, polyuria will be there. These are the signs and symptom of hyperglycemia. So here, what will be the adopted one answer? What is the best answer? It is thirst, blurred vision, and diuresis. Okay, these are the answer. So D is the option. Got the point? So very simply, you can answer if you know what is the signs of the hyperglycemia. So see next question. You will see all the TPN questions so that any question come, you can easily answer it. Take the key points so that if it is, you take the key points, very useful during your examination. A nurse is making initial round at the beginning of the shift and notice that the parental nutrition bag of an assigned client is empty. Which of the following solution readily available on the nursing unit should the nurse hang until another parental nutrition solution is mixed and delivered to the nursing unit? Okay, here you have to remember parental nutrition. If you just stop suddenly, what will be happen? There will be the high chance of the hypoglycemia. Patient sugar level will be go down, patient go to hypoglycemia and confusion, coma also, it will be very dangerous. Okay, so you have to remember parenteral nutrition not ready. It is not the next bag coming before you have to connect some solution. What is the solution that? To prevent the hypoglycemia. It is 10% dextrose in water, remember, okay? So it will be available. So before coming the next bag, you have to connect the 10% dextrose. So after coming, you can just disconnect and connect the new bag. Got the point? So what is the answer? It is 10% dextrose in water. Okay. Let's see the last question. A client is receiving parenteral nutrition in the home setting, has a weight gain of 5 IP. I have told you already, they are not giving in kgs. Okay, 5 IP means 5 pound. It will be 2.2 kg. Okay, in the 1 week. The nurse next assess the client to identify the process of which of the following. There is the weight gain. I have told you already. It is the chance of what? Hyper. There is a hyperolemia. Okay, so what is the signs of hyperolemia? I will tell that first so that any signs, if you just find out, you can easily be answered. Okay, signs of hyperolemia including weight gain. Okay, and there will be the headache, jugular vein distension, bounding pulse. There is a crackle on the lung auscultation because the lungs filled with fluid. So there is a crackle sound on the lung auscultation. So here they have already given that is the weight gain is that. Okay. So next, what is the next assessment the nurse should do? There is hypertension? No, there is no hypertension. Thirsty, polyuria, not this on all the signs. So what will be the answer? There is a crackle upon auscultation of the lungs because the fluid will be filled in the lungs. There is a signs of hyperolemia. Okay, they have given already the key point hyperolemia weight gain. So next point you have to be find out crackle upon the auscultation of the lungs. Got the point? So this is the answer. So these are the all question about TPN. Okay, so take down the key notes so that before the examination, if you go through, it will be very useful for you. So more sections, we will see the different kind of questions. So in the YARKUD International, we are giving the online training for Promotric, SNB, MOH, THA, HAD, OET, and IELTS, and OMAN PEARSON VUE nursing examination. All the nursing examination, you can have the coaching on YARKUD International.